So this process of applying to residency, but more specifically to Perio, is not easy. And everyone has their, kind of not struggles, but things that are challenging for them. So what would you say has been the hardest part for you about this process of applying to Perio?
I think that the hardest part for me was really putting myself out there, networking, getting to know other people interested in Perio residents, talking to program directors with, about questions, finding mentors, putting yourself out there. For some people, it can be hard. And for me, it was a little hard, to come out of my shell and really just brace myself for whatever the outcome could be. Because, sometimes you hear stories, people don't match. You put in all this effort and nothing happens. You don't get in. And so for me, I was a little scared, shy, hesitant, but I knew that this is what I wanted. And so I really had to push through and overcome that. So that was the hardest part for me.
Periodontics, the foundation of oral health. Also, where oral health and systemic health either connect or they collide. Stay tuned as we talk to a D4 who just matched at her top program for Perio to become a board certified periodontist. Stay tuned. Hey, this is Dr. Darwin, the new dentist coach, another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, getting into residency, and then life as a new dentist. Guys, thanks so much for joining us today. We got a jam-packed episode, and we are really excited that you guys are continuing to share, to consume, and view. Feel free to also comment down below. That helps other people get to see and get notified about episodes that are helping people get into residency. And feel free to share as well, but also support. There's many ways down below. Support the channel so we can continue to bring you this complimentary information that's helping so many people get into dental school, get into residency programs, and then also support them in their lives and launching their careers in their lives as a new dentist as well. All right. Also, this episode of Ask Dr. Darwin is being brought to you by, right down below, right here, getintodentalresidency.com. Getintodentalresidency.com, the ultimate resource to help you match into your dream residency program this cycle. For more details, go to the link below, and we hope to help you. We look forward to helping you with getting into residency this cycle. So, residency, that's one of the topics today. It's the topic based off of periodontal residency, and we're joined with a person that's been on the show before, been on the episode before. It's been a while because she's been busy. She's been in dental school for the last 4 years, but now she's getting ready to finish up those 4 years and continue on into Perio, into the foundation of oral health. Today we're joined by D4 student Dr. Fransisca Meralus. How you doing?
I'm doing well. Thank you for having me. How are you?
I'm good. Probably not as good as you now that you've got maybe what, 5 months left? Five
Yeah,
months
about five
left?
months.
Yeah.
Yep.
Yeah. And I remember it was like first, not even 5 weeks in to the D1 year where we were talking about getting
Hmm.
to dental school, and time has flown. So but for those people who may not have seen that episode, please feel free to share and tell us a little bit more. Just introduce yourself and tell people who haven't met you for the first time.
Okay, well, I'm Francisca Morales. I'm currently a fourth year dental student at Meharry Medical College School of Dentistry. I am originally from Miami, Florida, born and raised. I'm Haitian American, and I got my bachelor's in nutritional sciences at Howard University. Um, and now, as a D4 student, I'm just trying to push through, finish my requirements, get more periodontal related experiences, and start residency in July.
Yes, yes. And guys, make sure you you stay on all the way through. We're going to do a reveal of where she's going to be taking her talents to and some of the other programs that she applied to. She's going to give us some tips for those of you that are considering perio as a specialty. Again, we're going to talk about her interviews, how she came up with her application, all of that. So stay all the way through, all the way through. Which leads me to my first question, which is why perio? Why are we talking about perio when everybody, except for you, of course, uh, is concentrating on ortho, pedo, and oral surgery? Why did you decide to go into perio?
So, as you previously mentioned before, perio is really the foundation of dentistry. You're looking at treatment planning, and every patient has some type of perio involved in their treatment plan. A lot of the work that periodontists do is very transformative, and there's a big connection between oral health and systemic health that you see in periodontics. A lot of the treatment plan and the treatment plan outcomes are based on a patient's systemic health. If they have diabetes, high blood pressures, cardiovascular disease, how is that going to affect their periodontal health? And how can we get them to good periodontal health? And so that really drew me in that every patient I see, no matter how good or bad their periodontal health is, I can help them, not just their oral health, but their systemic health as well. So,
Yeah, and
yeah,
I
that's
would
my why.
well, I your why is gonna continue to be strong because you already know, and those that maybe are in clinic who are D4s or practicing dentists, you know of our struggles with patients who come to the office and say, I just need a cleaning.
Yeah.
I just need a cleaning. Doctor, hey, I just need a cleaning.
Yes.
Dr.
Yes.
Morales, I just need a basic, can you just give me a base? I just need a basic cleaning. That's all I need. And, not knowing that things don't have to hurt to mean that it's a problem. There's
Yeah.
it's almost like perio is kind of like the silent the silent killer disease of your mouth and the systemically, right.
Hmm.
You know? It is the foundation for many reasons, as you noted. Um,
Hmm.
Next, we want to know about the application because just like applying to dental school, applying to residency is, guys, it's a lot. It's a lot,
It's a
and
lot.
uh, and and
Mhm.
and when there's competition and when there's high stakes involved, that application is so very, very important. And in preparing for the application and getting your application together is important because it's the main thing that programs are going to have to look at you as a candidate to get you to the next step, which is the interview. But you got to have a strong
Mhm.
application. It has to be put together. It has to be what programs are looking for, but also demonstrate uh, who you are, what you've done, and what your potential will be moving forward in the future. So tell us a little bit about your application. How did you start the process of getting your application together and things that you did to build a strong application that's worthy of not only an interview, but subsequently a match into
Mhm.
Perio, right?
Yeah. So definitely around December of my D3 year, I knew that I was going to pursue periodontics. I knew, okay, now is the time to start. And that's early because the application does not open until May. But in December, during that Christmas break, I took the time to really map out what my application would look like. And so in January, I started on my personal statement, my why, why am I pursuing this? How can I convey that in a page on paper for them to read, outside of my application. That was important to me. I got my CV together, organized, current, up to date. And I made sure that those two things were ready along with my transcripts so that in March I could ask professors and different periodontists to write me letters of recommendation. And again, the application doesn't open until May, but I asked them in March, just so that that gave them enough time to, write what they needed to write. They had my personal statement in my CV. In addition to having a relationship with these people, I gave them everything that they needed in time for the application. And I would just say in May, as soon as it opened, if the letters were ready, they were uploaded, transcripts were uploaded, and I really just applied early. So about 2 to 3 weeks after the application opened, my application was submitted. And yeah, I just really applied early. I got my things in order, all my ducks in a row, and I was ready to go.
Yeah, and it's important to note the word early.
Mm-hmm. Heavy
Spec-
on early.
Heavy on early, specifically for PERIO. And I say that because PERIO is one of the specialty programs that have a quote unquote early timetable, meaning in match, they're phase one. There's two phases. And PERIO is in the phase one of residency programs. So it's PERIO, there's endo, but not all endo programs are in match. There's what's the other one? Prosthodontics, and then there's also if you're pursuing residency in Canada, all the Canadian GPR programs are in phase one of match. So that means that the application cycle opens up earlier for those programs, uh, and that means you have to, like you said, start much early before that application opens up in May. You have to start much earlier to get all your ducks in a row and your pieces of your applications, your letters of recommendations, what we'll talk about in a minute. But that early emphasis is very key. It's across the board for all the programs, but especially
Yes.
for those that are phase one match programs or phase one application programs. So keep that in mind as well.
Mm-hmm.
It's Dr. Darwin, your new dentist coach. Hey, look, it's residency time. It's residency application time. And the biggest question that a lot of people have is how do I prepare my application? So look, if you're struggling in getting your information together, your CV, your personal statement, or you're ready but not prepared for your interviews, reach out to me ASAP, right? Right? Through my group, Dental Residency Headquarters, we can help you. We can help you get ready for this residency cycle so that you're able to do this. We want you to match into residency cycle this year. All right. But you got some work to do. If you need some help with that application, shoot me an email at newdentistcoach@gmail.com. Newdentistcoach@gmail.com. And through our program called Get Into Dental Residency, we can help you. We can help you. But you got to hurry up because residency application is right now. It's right now. So shoot me an email right now. All right, let's get back to this episode. So application means that you also have to apply to schools or apply to programs. Share with us that process for you as to why certain programs that you applied to, the number of programs that you applied to. Was it a mix of school-based, hospital-based, VA-based? There are some VA hospitals that have dental periodontology residency programs. So share a little bit more information about that.
So definitely when you submit your application, a lot of schools have supplemental apps. And so applying early, is very essential because then you have time to work on the supplemental apps and get those in because that takes time too. You never know what a school is going to ask of you. If they're asking for another essay, if they're asking for a portfolio, just to have that already. And for me, it was
Oh,
important.
wait a minute. You said a portfolio.
Yes. So some programs ask for that, like research-based programs. They want to see, what research you've been involved with, and if you've done any, perio-related cases.
Ooh, you got some people really mad right now, Doc. Because
So it's a lot of work. It's a lot of work.
well, they mad because they didn't realize that you may have to have a portfolio as part of your application. Uh-oh.
Yep, the supplemental applications will really get to you. They really will.
So those that are listening, watching, look, this is why this content is so helpful because I forgot about the portfolio. I forgot about the portfolio as related to Perio. I know there are some endo programs and maybe even some pros programs where you may have a portfolio or there may be some discussions or hints about a portfolio. But I totally forgot about Perio. So now all of us are like oh man. So that means you got to start even earlier. Now that you guys have this gem that was just given to you on your lap, now you've got to go back and start even earlier because if you are considering perio, you need to have time to make sure that you have some exposure to research slash working with others, anything that you can put in a journal
Hmm.
to demonstrate your your interest, but also your body of work as you are going to lean in to the specialty. So I just had to stop there and put a pin on the word portfolio because I totally forgot. And uh, that's why you have to do your homework much earlier when you're
Yes.
investigating these programs. Because, like you said, supplemental additional requirements will come, and you'll see them once you do a deeper dive into the programs in the schools. And so now you're not surprised when you guys see that portfolio requirement. You're not surprised now. So there you go. So you mentioned that. What else about the schools did
So
you use?
So for me, things that were important when making my list of schools to apply to was definitely location. The location was big for me. Where am I going to live for the next 3 years? What does that city or town look like? And outside of school, like how would my social life look in this city? So that was important for me, especially being born and raised in Miami. I hold cities to a standard. Um, Clinical experience versus research experience for me out of a program, I wanted a little bit of both. Some programs are, they have a very strong clinical base, and that's what their residents are doing 90% of the time, while others have programs that are research based, where you're in a lab, you're focusing on your research more than you're doing patient care. And so I wanted a good balance of both out of a program. And so that helped me pick schools and definitely the network. What type of network would I get out of a program once I become a board certified periodontist? Like, what other periodontists can I reach out to that have been through this program that can
Right.
help elevate me to the next level? That was very important.
Yeah.
Um, and you can see that, for me, when I went on my externships, I got to see, ask questions to third years, second years, first years, and kind of get a sense of what was going on in the program, how past residents are, helping them into their new careers and, XYZ. So in total, I applied to 9 programs. I started off with a list of 15. And I narrowed it down based on those 3 things that I mentioned earlier: location, clinical experience versus research, and the network.
So 15 on your list, narrowed down to 9
Mm-hmm.
based on your priorities. Uh, was it
Yes.
was it was it also a mixture of both school-based programs, hospital-based programs, or VAs or anything like that? Was that part of it, or it just came, based on the 3 things that you were really looking for? That's how your list was developed, and those 9 schools or programs were based off of that more so. Okay, I just
Mm-hmm.
only want to do a school-based program, or I only want to do a VA. It wasn't based on that. It was just based on the schools and what you were looking for, and you
Yeah.
came up with your list. Okay, I got
Mm-hmm.
you. Yeah, that's important to know because some folks will be looking at programs and they only want school-based programs.
Yeah.
And if if the whole notion of having to pay tuition versus receiving a salary or a stipend as a resident is important to you, that will also
Yeah.
could also be dictated by the type of program or the practice setting or the type of program that you are pursuing. You mentioned something that is part of the application process, which is externship.
Yes.
And I think you got some more people mad now because they may not have thought about the fact that yes, externships where you go visit the program and you carve out, a week or however long the
Mhm.
program, the externship is, you carve out time to get to learn more about the
Mhm.
program, but also more about Perio at that program is key. I wanted to mention that so that everyone knew that searching for programs or opportunities where you can do an externship is going to help you with your application,
Yes,
your
definitely. I agree.
your candidacy. So uh let's talk a little bit more about that when we get into the tips and advice because
Mhm.
I'm sure you have some things to share with regards to that. But I want to get back to the schools because once you submit to the schools and programs, next comes it's probably the second most important part, which is the interviews,
Oh,
right?
yes. The interviews.
You sit around, you do all this hard work, not to just apply, but you do all this hard work so that you can get to the next step. Uh,
Yeah.
and the next step is the interview. So let's talk a little bit more about the number of interviews that you received, um, where those locations were,
Hmm.
programs, and some information about the interviews as far as maybe if you remember some of the questions, some of the maybe not so usual questions that you were like, oh, got me on that. I got
Yeah.
hard. I mean, all that's important too. So
Okay, so out of the 9 programs that I applied to, I received 5 interviews.
good.
Those interviews were for University of Florida, University of Alabama at Birmingham, University of Tennessee at Memphis, University of Pennsylvania, and Harvard University.
Ooh,
So I received those 5 interviews. And I did prepare. It's very important to prepare for your interviews. I did multiple mock interviews with residents, periodontists, and even faculty at my school, just so I could be comfortable, being able to say what I wanted to say in the most genuine way. And also to prepare me for anything, even though I know these people and I'm comfortable with them, they could throw a curveball at me, and I need to
yep.
be prepared to just say what I have to say. And
So,
so,
we'll throw the curveball back.
yeah, definitely. And that was really good for me because they gave me tips and things to work on about myself. Me, I'm the type of person I like to talk with my hands. So things like that, body language, just certain questions that I should be prepared to, spit out, on command kind of type thing. So that was very important to me doing mock interviews. And when I actually got to my interviews, I realized that it was very conversational. At the end of the day, these people have looked at your application. You're obviously qualified. They liked your application. They wanted to come meet you and see what you're about in person.
Yep.
And so it was very conversational. They really asked me a lot of questions about myself just to get a sense of my personality. So nothing was really hard. It was really shocking and surprising how laid back and easy a lot of the interviews were. I think a shocking question to me was, if you weren't going to be a dentist, what would you do otherwise? And I was like, I never thought of that because I'm on the road to becoming a dentist.
Right.
So on the spot, I just said, I think that I would be a news anchor or TV personality. I think I would do well. And the interviewer, he agreed with me. He was like, yes, you're well spoken. I think you would do good on TV. So things like that, those came as a shock to me, but it also helped me feel comfortable to talk with the interviewer. So yeah.
Good.
I just would like to say, be yourself in these interviews because at
Oh
the end
yeah.
of the day, they just want to get to know you.
Yeah, and
So,
and and you who you genuinely are is who they're going to get for
hmm
those uh uh for those 3 years, right? So,
yeah.
anyone could be on their best behavior for
hmm
a day in an interview, but trust me, we as interviewers, we do this so much over the cycle of of years, over the period of time, that we can tell when someone's being genuine and being themselves, right? And
hmm
and so just be that, because at the end of the day, when you get in, when you match and you start on July 1st, so a little bit earlier, um, they're gonna have a lot of time to see who you really are, and
Yeah.
and they have to deal with you, and you got to deal with them for that period of time. So just be yourself, right?
hmm
Be yourself, because
Definitely.
that's who you're gonna be when you get there.
Exactly.
You're gonna
Exactly.
be yourself. Um, any other questions outside of the typical tell us about yourself, why Perio, um, questions? Now, I think you got lucky, and I'm surprised, especially from UPenn and Harvard, that because those two programs are very well known for, like, having being having residents slash faculty members, attendings, professors that are in national or international journals for Perry on research.
hmm
I'm surprised they didn't ask you any questions about a research project or ideas that that you've explored. And I'm surprised that you didn't get any questions related to draw us a cross-sectional view of the of the of
Oh
the
my gosh.
of the periodontium.
So I will say I did get one question about research, and it was genuinely about when you come here, what would you like to explore? Like, give us a
Yes,
topic.
good.
That's really the
Yeah.
only research question I got, and it was actually from one program. And I had never prepped for that sort of question. So in the
Ah,
moment, I really had to think about what would I be interested in looking at. And so in the
yeah.
moment, honestly, I can't remember what I said, but the interviewer was very interested in what I had to say. And he even proposed some subcategories that would go with my research project.
Look
And
at
so I
that.
guess
Look at
my
that.
way of
Working as a team
thinking.
already.
Exactly, exactly. So it just worked out. But when you say like these programs, big international journals, like to me, these were regular people. And some of them I've read their research and meeting them in person, it was very like, wow, very humbling, but they were so laid back and chill. Like these are regular people. So I was shocked they didn't ask me about my research as well. But it was great either way. It was great.
Yeah, yeah. So tip for your interviews, guys, not only get some help and do some mock interviews and work with some people that are familiar with what those interview days are going to be like, and those questions are going to be like, but also have some ideas, especially for perio or residency programs like perio, endo, or surgery, pedo, that are heavily research based, evidence based dentistry, uh, as well. Have some ideas of some topics that you may want to explore. You don't necessarily
hmm
have need to do research in dental school to have some ideas that you want to explore, but you do need to have some ideas that you want to share with the committee, because you can't say you want to be a board certified periodontist and you don't know nothing about any research, because that's
hmm
what you're going to be doing as a resident. You're going to be engaged in some research related activity, whether
Definitely.
it's some surveys or whether it's a review of the literature, and you have to present it. and you may have to expand on it. So, quick tip: we haven't even gotten to the tips yet. You got like 2 or 3 already, but more is coming. More is coming. So, um, usually after you have your interviews, you got all this information from these programs for you. You got information from U Florida, UAB, Tennessee, UPenn, and Harvard that you've got to look at and be like, okay, now I got to rank my programs. I got to put them in the order that I like, and which one is my number one, which one is my number two, three, four, and five, because that's your job as a candidate, right? You have to rank the programs just like the programs have to rank candidates so that you have a match. Now, I do know, and I think you shared with me previously, before today, that not all of PERIO programs are in match.
Mm-hmm.
There
Yes,
are some non-match or kind of programs that don't routinely or traditionally rank candidates. They interview candidates and they make offers right on the spot. Within, to the point where you have to respond within maybe 24 or 48 hours, either yes or
Mm-hmm.
no. And if you say no, they're like, okay, thank you. And they go on to the next person. It's almost like rolling admissions until their program is filled, which is a little bit different than traditional match programs where everyone has to rank and then there's a match day and the results are released and you go to you may go to your top choice or you may go to your third choice, but you've matched and you're connected to a program. Tell us a little bit about your process for PERIO, because I think you've got some non-match programs in your portfolio.
Yeah, definitely. So when it came to choosing what school would be at number one, definitely I had externed at some of these places that I received interviews. And so I think that going into my interview, I was a little bit biased. And so I told myself at the beginning of interview season that I would definitely, um, come in there with a clear headspace and give these people a whole new second chance. You know, even though I, loved them previously, I was like, today is different. This is a day where I have to take in the program for what it is, see how they really truly accept me and see how I respond to them. And so, definitely after my interviews, I had different perceptions of some programs, which is very good. If you realize that you don't like a program, like that's better for you than to really kind of turn a blind eye to whether or not, the feel of a program. So out of the 5 places that I got interviews to, 2 of them were non-match and the other 3 were match. And so the way PASS works is, like you said, Dr. Hayes, it's kind of an on-the-spot thing. A lot of programs, maybe a week after your interview, offer you a spot and tell you
Yeah.
within as soon as 24 hours, sometimes as long as a week to
Yep.
decide.
Yep.
And if you're getting an interview in September and match isn't until November, it's like, wow, I have to decide before I even give match a chance where I'm gonna go to school. And so that was a little tough.
Yeah.
But yeah, it
And
was
it
a little tough.
and it sounds like a couple of your offers might have been from non-match programs.
Yeah.
Yeah. Yeah. Uh-huh.
Yeah.
Uh-huh. Well, let's just continue to unpack it. Let's do the match reveal right now so people know which
Okay,
which
okay.
which non-match program extended or programs extended you some offers. Where's the drum roll? Ain't nobody here on a Saturday. Everybody
I can
come.
make one for you.
Let's make a drum roll. There we go. Here we go. Here we go.
So
So,
out of the 2 past programs that I applied to, UPenn and Harvard, I did get an offer of admission from Harvard, which I gladly accepted, and I'm super excited. I'm super excited to attend. I had a great interview there. I was even more surprised at how comfortable I felt there. And so not only did they check off all my boxes out of what I wanted in a program, but I just felt good being there. And that was very important to me on my interview day. How did I feel? And so I'm really just happy, elated, excited, all of the above about being able to go to school there. And just knowing in advance was great too. It's great.
Miami to Boston.
Yes, yes.
Boston will never be the same now. Boston. Oh,
It won't be.
excuse
It
me.
won't
Excuse
be.
me. Boston. You got to learn the. You're gonna have to change. You got to change the vernacular from 305 to 617. That's the area code for Boston. In case you didn't know,
Yeah.
617. You got to change it to Boston. So
Boston.
Boston. Well, Harvard, you got a good one. Got a good one coming. That's
Yeah, I'm really
that's
excited.
that you should be. You should be. That's big. That's big. Harvard. Harvard. Okay. We got people going to Harvard on the show. Actually, I think you are the third resident that I've talked to in the last 2 years that are going to Harvard. First PERIO resident, but there's
Mhm.
also two endo residents that are there right now. One's the second year, and one's a first year resident. He's from
Mhm.
Canada, and the young lady is from, I forgot where she's from. But perio, endo, y'all gonna probably be interacting somehow, some way, and
Definitely,
some case
definitely.
presentations, and you know, especially since the endodontists are now placing implants. Yeah,
Yup,
so
yup.
I suspect that you guys will have some cross program or intra
Mhm.
programmatic activities working with the Perio residents as well. But again, congratulations, Harvard. That's big. Tell us a little bit about Harvard's program, um, because again, one of the things for many people about applying to certain programs or school is, cost, tuition for these advanced uh, uh, dental education programs. Some are tuition based where you got to pay tuition, and some
Mhm.
are stipends where maybe you work for a hospital or they're hospital based and you get a stipend or you get a salary for that year. Tell us a little bit about that as it relates to Harvard, what type of program that is, and then what you know about perio in general related to life after residency as a board certified periodontist and the types of compensation that you can expect.
Yeah, so definitely periodontics is the best specialty that there is. I will say that. Harvard is definitely a school-based program, so I will be paying tuition to go there, which was all right with me. I think in the end, the whole stipend versus tuition, that wasn't really a big factor in me deciding where I applied because at the end of the day, I'm investing in my education. I'm investing in my career. So that wasn't a big thing, but it's always a plus to get paid. But I do know within Perio, getting paid is not that common. And so programs that, you do get paid and you don't have to pay tuition, it's a lot more competitive because a lot more people are applying to those programs. So I kind of just took that out of the equation. Um, so I will be paying tuition. I won't be getting paid. But if we think about life after residency and the
Yes,
compensation,
yes, let's talk
it's
about that.
definitely worth it. The return is definitely big. I think it really depends though if you decide to open up your own practice straight out of school, you probably will be paid a little less because of the overhead cost of running a practice. But if you go and work with someone in private practice or even for a DSO, you might get paid a little bit more. And so I'm thinking that the salaries start, depending on cities and states, 200,000 and going on up. Again, if you're opening your own private practice, I do know it's a little bit lower, just until you get up on your feet and then you'll start making the big bucks.
Yeah, and rightfully so. And probably periodontists don't get paid enough, especially with the connection and the nexus between systemic health and oral health that still is on the table, and we're trying to bust it out of our silo of oral health so that we, can continue to preach and advocate for the integration of oral health with overall health and why it's important, right? You
Hmm.
also mentioned, the salary range, and those salary ranges will also depend on another thing, which is academia. That's an option, right? There are a lot of
Hmm.
people that decide to teach. I can think of my perio instructor, our perio instructor at Maryland, Dr. Grishanda Branch Mays, periodontist, who's been in academia for a while, who's now, I think she's maybe vice dean at University of Missouri out in Kansas City, Missouri. But she's been like, chair of perio at many different schools as well.
Hmm.
So that's an option. DSOs you mentioned, oh my goodness, look, I talk to specialists all the time that are getting recruited by DSOs. And in addition to these high salaries, there's bonuses that are well, I'm sorry, sign-on bonuses, not even production-based bonuses, but just sign-on bonuses in addition to production-based bonuses as well. So that can greatly increase your compensation uh, and expand the range over and above 200,000. What's tuition at Harvard, so people know?
I'm looking at around, I don't know if this or the next upcoming school year's calendar, the tuition has been released, but based off of this past school year, it's around 60,000.
Right. Okay.
Yeah.
Yep. Yep. So there you go, guys. Another uh, data point with regards to schools and programs and what you can expect to pay um, for your advanced dental education and specialty in perio. So we've talked about applications to schools, your interviews, your ranking. We know you're going to Harvard. Congratulations. Now it's time for the uh, the starch, the meat and potatoes here. The one of the
Yes.
main parts that people who have followed all the way through and listened all the way through, this is their reward. And that reward is tips, strategies,
Hmm.
knowing what you know now and having gone through this process, and it is indeed a process. What tips or
Hmm.
advice do you have for applicants, people who are listening right now, who are considering Perio or are putting together the application for the next cycle right now? What are some tips that you want to share with them that will help them with their application and their candidacy?
Definitely. So I have about 4 tips. The main one is to find a mentor.
Mm,
Um, find someone in periodontics, a periodontist who is established already. Find them, ask them questions, get to know them, get to know how their career is going, why they chose periodontics, what they've done to get to where they are, and ask them for advice because that was important for me. I wouldn't be here without my mentors. And so, I definitely pay homage to them because they really invested in me. And I appreciate that, taking the time to let me come shadow them, to answer my questions, to hop on calls with me, to do mock interviews with me. That was very beneficial. And you can't get that anywhere else besides from a mentor. So definitely find a mentor. Apply early. We emphasized this earlier. Applying early is only going to help you, and applying later only hurts you. So definitely apply early if you know this is what you want to do. Get a head start on that personal statement. Have multiple people read it, have your mentor read it, a periodontist read it, faculty read it. That's very important. Get your CV together, get your letters of recommendation together. And then some schools, they keep the supplemental app year to year. So if you can look at it now to get a head start on preparing that, do that. That's helpful. Um, shadow, shadow, shadow. You want to go into periodontics, you need to understand the field that you're getting into. You need to see what's going on a day-to-day basis. Do you see yourself doing this long term? Is this the career that you want to be in? And with that comes doing externships. Not only does that give you exposure, but that allows you to get to know a program and allows the program to get to know you. You never know. That could be what gets you an interview. These people seen your application, they've met you prior, and they thought you were a delight to have for the week that you were there. And now you have an interview, and all you have to do is be yourself, which is my last piece of advice. Be yourself. Um, I know it's scary and it's hard and intimidating, but at the end of the day, once you get to your interview, these people really just want to get to know you as a person and what you can bring to the table as a periodontist. So those are my tips, my advice.
Yeah, those are some great tips. Great tips. Find a perio mentor, apply early, be ready for the supplemental application components, whether it's another essay, whether it's a portfolio as well, right? Shadow,
Mm-hmm.
shadow. And also add on to that, the find those externships. They are out there. The
They are.
externships are out there, even if it's for a week. You can't be a serious perio residency resident and candidate or candidate for residency if you haven't done an externship
I agree.
or shadow directly in a board certified periodontist office. You can't.
Yep.
You can't. It's just like dental school. You can't say you want to be a dentist and you haven't shadowed in a dentist office.
Exactly. Exactly.
Like, come on, really? So that's important. And last but not least, as we said it before, be yourself, because who you are is who the program's going to get, and that's what you're going to give to the program. You're going to give of yourself, and programs need to know who they're getting. And your interview day is the great opportunity to share with them who you are, your characteristics, and how you're going to contribute to the program and to the perio specialty as well. And all of this information has been great. What's the best way for people to contact you if they have any more questions?
So the best way is through my personal email, which is fransisca.meralus@gmail.com. So my full name dot my last name @gmail.com. That's the best way to reach me.
Right here. Reach her right here. And today has been a great day. We get to almost go full circle here since about 4 years ago since we talked. You got into dental school and you were talking about your first year in surviving dental school, and now you're surviving the 4th year after going through the match and the residency selection process. So very happy for you.
Thank you.
Harvard is not going to be no joke, but it's one of those it's one of those programs where, like you said, the network and the alums that have gone through that program, it itself is so valuable for a lifetime of professional development. Just networking with those alums and those people that are connected to the program as well. And we thank you guys for being connected. Hopefully, also you guys will connect with love, peace, and smiles. Go to the next video right now. Push this button. Push that button. Go.
Next assignment is go to the next video. Go to the next video right now. Go. Love, peace, and smiles. Go to the next video. Go to the next video.